the truth of the matter is whatever you're doing for your patient has to be evidence based.
Yes.
There should be a rationale behind what you're doing.
Yeah.
So research is actually like very, very important because as much as you want to improve your patient's care, you can't keep using the old ways if I get still getting the same result. So it's the bid of getting the new result for a particular patient's care, there should be a new approach to it. And to be able to find out that new approach, you need to conduct a research.
Hi everyone, welcome to another episode of Nursing Unscripted, a show that is centered around candid and unrefined conversations in nursing. Thank you for always liking, subscribing. Today, I have with me someone who is a nurse and also she's in the technology aspect. She's a data analyst as well. So together, we would be unscripting, transforming the healthcare, the role of nursing research in advancing the nursing practice. Let's get started. Hi.
Hi.
Thank you so much for coming on the show. It's
Thank
our
you.
pleasure to have you here. So wait for this one. So can you briefly introduce yourself and tell us about your nursing journey?
Okay. My name is Faith Omoshawa Akintade. I'm a nurse and I graduated last year. That was last year November. That's when I got inducted
That's
into the
amazing.
nursing profession. And I'm a nurse intern at the moment at Obafemi University Teaching Hospital, Ife here. And also I'm a data analyst, if I can say that.
Yes, you're permitted to. Thank you so much for that response. So moving on, can you tell us about the impact of nursing research on healthcare transformation and nursing practice?
Okay. Thank you so much for that question. I will start by kind of defining what research is. Let me put it that way. So I think research is more like it's more like investigation. So it's like a systematic process of investigating questions and so as to generate new ideas, new knowledge, or to validate an existing body of knowledge. So in nursing, like for every field, let me put it that way, for every field, as well as nursing, because everything needs to like improve in whatever knowledge they have in that's existing. They need to see what is changing. So to be able to do that, you need to conduct some researches, and it's involved collecting data, analyzing the data, and then laying back your findings. Yeah.
Yes, so
That's what it's
that's I think that's very amazing. So research is just about looking for new ideas or elaborating the already existing ones. Yes. So can you give practical examples on the impact that nursing research has actually had on the profession?
Yes, yes, I can. Um, I've been taught that nursing is both science and arts.
Yes.
So, and for nursing to be a science, it has some scientific rationale backing up whatever act you are doing. So, as a nurse, you are caring for a patient. So, whatever act or whatever type of care you are rendering to that patient, there should be a scientific rationale behind what you are doing, and to be able to establish a scientific rationale behind what you are doing, there has to be new findings,
Yes.
new reasons why you are doing this thing. So it's research helps in ranging an evidence-based practice, like practice care to that to a nurse. And in that sense, when you are ranging an evidence-based practice to a patient, you tend to like improve their
Yeah.
care.
Yes.
There's improving patient care outcome as well. So I think research has a very huge impact on nursing practice because you can't just keep rendering care that you don't know the reason why you're actually doing this thing. For so if you are rendering a care and they're asking you, so why did you administer this particular drug to this patient? So like it's just one of the available drugs. You don't know the reason, you don't know
The reason
even
why
the
you're doing
mechanism, how this thing is going to work out. So yeah, I think that's why research is very important.
Yes, I even think concerning the evidence-based practice, that's what actually distinguish professional nurses from unprofessional.
Exactly.
And I hope you've seen a library.
Yes, I have. Of course.
Yes,
I watch it
yes.
countless
Oh,
times.
that's very nice. That's very amazing. So moving on to the next question, what do you think are some common misconceptions that nurses have about research, and why is it that there is low participation in research, especially in Nigeria?
Misconceptions about yeah, I would say nursing is actually the rate of nursing participation to research is actually very, very low. Like it's low. And I think one of their misconceptions is the fact that they felt like research is more academia than it's clinical. They felt like it should be in the academic
Aspect.
aspect more than it should be in the clinical practice. And they felt it's more theoretical that what I'm doing to my patient has to be practical. I'm supposed to be doing it with my hands. But the truth of the matter is, whatever you're doing for your patient has to be evidence based.
Yes.
Exactly, like I said, that be there should be a rationale behind what you're doing.
Yeah.
So research is actually like very, very important, because as much as you want to improve your patient's care, you can't keep using the old ways if you are not getting a new result. If I get still getting the same result, so it's in the bid of getting the new result for a particular patient's care, there should be a new approach to it, and to be able to find out that new approach, you need to conduct a research. So yeah, that's one of, and another misconception is the fact that they feel like they can't really make changes with research. They felt people have been doing it. I mean, if people have been coming to paper, have been feeling there's no really changes going on in nursing. But the truth of the matter is, research has both short term and long term effects. So there are things that have to be carried out over and over before it becomes a theory. You know, you can't just say this particular new idea, oh yeah, you already tested it once, then it has to just go on. No, it has to be practiced over and over
Yes,
to be able
over and
to
over.
show that okay, this is giving the right result we want to get.
Yes.
And I think those are some misconceptions about
About
and why
it.
their participation is low. And they always feel like they don't have time to. Of course, yeah, nursing is very tedious. It's time consuming. It's if you're not careful, you can get consumed with the work
Yes.
itself. So they feel they don't have time, and they felt like what will the institution say about this, or the ethical dramas that has to surround research. Those are the misconceptions.
Oh, yeah, that's amazing. Thank you so much for that response. So, how do you think schools and even the healthcare system can actually incorporate research findings into the nursing practice?
Yeah, I thank you. That it's actually intertwined, because as much as you are doing research, there's always the last phase of research that's relaying your findings
Yeah.
to the target population or
Yes.
to the body you wanted to they are targeting. So there's no joy in researching and finding a new result, and then you audit the result
The
or you audit
result,
your
yes.
findings. So you have to relay it back. So relaying it back now, let's take it to the scenario of, okay, the school that's conducting research, I want to improve the patient healthcare. And
Yes.
how do we improve patient healthcare? It has to be done in the healthcare
System.
system. So if probably a research has been carried out and then you find a new approach of caring for a patient, it has to relate back to the healthcare and then them see the importance and the reason why this thing is going to help and improve patient healthcare. And at the same time, you can incorporate these new findings into student curriculum. Because as much as patients we nurses have been trained in school, like
Yes,
not in the hospital yet. So when you are trained in school, probably you were taught in class that this is how this thing is done. And you get to the hospital, it's still same old practice they are still practicing there. They are not incorporating the new
New
findings.
one.
So having a collaboration between schools and healthcare will help to improve the and we have to appreciate the findings that you got from your research as well. So there should be a collaboration between the school and the healthcare. So as much as students go to hospital for postings, they will appreciate research well, because you see what you've been taught in class and you see that they are practicing it on patients and you are seeing the impact on patient healthcare. So
Yes.
those are, I think, ways you can incorporating schools and research together.
Okay. Let me ask you this. While you were a student, did you like have interest, like were you so passionate about research?
As what no, I feel like as first no, I did not really like it, but I give my interest in it when I started data analysis, because you can't just say you want to analyze data that you don't understand what you are doing. So it's like something that actually like showed of my passion for research. I so much enjoy doing it because you get your hands on data, you get to see how people opinions of people on particular subjects or on a particular variable you are. It's okay, so this is how people think. Most of the time I have like this biased idea about things, and I just feel like people have different opinions about a topic. So most to answer your question, no, but with time I got so much interested in it, and right, I don't think I can really do without doing research.
Yeah, I think being a data analyst is actually an advantage because in school, a lot of students don't actually like research because it's kind of rigorous and time consuming. Like you said, yes. So, can you share with us an obstacles like that's common obstacles that nurses actually face while participating or conducting research?
The first thing I would say is time. Like I said earlier, still all this time, because presently we are conducting. I can't say I am. Me and my group, we are conducting a research at the moment, and we are using nurses. Midwives to be precise, but right now, I can tell you out of the let's say 300 target populations that we are looking towards, we barely have 1/10.
Wow.
Because they feel like they don't have the time to actually like sit down and fill your questionnaire for you. And then people that you probably are on their neck to help you fill, you can't trust what they are feeling. So much like, let me just fill it for you and go. So you might not really get the data you want, the honest data you want, let me put it that way. And at the same time, they felt like it's not in any way relating to some of the nurses, let me put it that way. They feel like it's not in any way relating to nursing. Nothing is practical, research is theoretical.
Yes.
So how do you think it's going to where are we meeting? But the truth of the matter is the practical things you are doing for your patient, it has to be evidence based, like I said. So and to be the way to actually like derive those ideas is from research. To be able to know that okay, this is why I'm doing this for my patients, and if I do it this way, I'm going to get this particular result over time. So that's one of the challenge time. And then the idea of it's not in my field, it's not clinical. And the fear of failure, let me put it that way, fear of failure and lack of confidence. Because research is very vigorous and it's time consuming. And it's require you to be patient because you can't just say you want to keep researching a particular topic. You have to look for gaps. And looking for gaps it requires your patience a lot. So the fear of failure, I think another way to one way to actually help people establish or to fight that fear of failure or lack of confidence is appreciating them, like acknowledging the fact that they actually help you in that research. Because if, let's say, for instance, I participate in research and probably just data collection or pilot study, and I'm seeing my name in one of the people that they're appreciating, I'll be interested more to do something related to research next time because I feel like okay, I think they're acknowledging my efforts. So I think positive reinforcement so we really help.
So do you think it's possible to be a bedside nurse and still be a nursing researcher?
Yes, I have nurses that I've seen that are both
That's
practicing
amazing.
and they're also researchers. Yes.
That's so nice. That's amazing. So can you share with us an inspiring example of a nursing research that has actually impacted the profession?
Yes, I'm going to pick our mother. Again, actually, because I think she conducted research on sanitation. So, and to make you appreciate the fact that as little as hand hygiene, it can go a long way to improve your patient's health. I will say a funny story when I started
Your clinical.
clinicals. Yes, I do not appreciate the fact that when we get to the especially morning duty, when you get there and they're like, nurses, clean your table, take that gauze, put spray and clean everywhere. I'm like, this is not my work. Why are you telling me to do this? But with time, you get to appreciate the fact that doing these little things helps to improve your patient's health care a lot. Like the outcome is always like there. Imagine you have a patient feeding through gastrostomy and the part has just been there over and over time. And then you are just feeding and feeding. You are not cleaning the whole site. You are not doing anything. Fine. Very to be feeding, but before you know it, infection is already there, and then the gastrostomy site is already like infected and breaking down. So that's another care on its own where you're trying to like nourish the patient to actually. So as little as eye hygiene, as little as keeping patient's environment clean, wound dressing, those things actually go a long way to improve patient's care a lot.
Yeah, like the popular saying, cleanliness is next to holiness.
Yeah,
I think
exactly.
cleanliness is next to good health.
Exactly.
And that's very amazing. So who is your favorite nursing researcher and what impact have they like made?
I don't know if I should pick from our OGs or the new people that we know in
And then
here.
you can just speak from
Okay, there's a particular nurse right now at ATC where I work. She's really good. I like my encounter with her was like I've always loved research, but meeting her was made me realize that I don't think I love this thing as much as this woman loves it. She's presently my supervisor. That makes it more interesting because even as when you are done with as a student doing your internship, you still get to go into research. That shows how important research is to nursing and how important you have to get evidence-based practice for everything we do. So, like I mentioned that we're conducting a research, she's presently our supervisor for that group. And we first brought a topic to her. Trust me, within ourselves, we already tried to find gaps. We thought we were actually like found the gap until she brought a study that conducted that exact same thing that we did. And then we had to sit down, reason together, look for gaps, like, okay, what have they not done? And then we did it together. And it was so interesting that we were so eager to actually like work together with that. So she makes it very interesting. And every time we have a meeting, I'm always looking forward to hear what she has to say. But she's very sound. And there's difference between This is not aimed to any nurse, but there's a difference between her and other nurses that are working in our world at the moment, because she's working based on updated information, not just the regular information that everybody knows. So I think that's one of the difference.
Yeah, I think that's what research does to you, because
Exactly.
you get to know more about what you're actually
Yeah, that's
doing.
true.
And that's actually very interesting. So, do you have any nursing content creator that you like?
Nursing content. I would love nursing nurse Tiwantiwa. Yeah, I like that woman. Don't know if I call her woman or a lady now.
So, why do you like her?
She comes up with nursing, I would like to say, like, probably health problems or health issues, and then she will explain to the society, like, okay, sorry, I'm trying to like bring
No,
up my
no
ideas
problem.
together. Is she knows our target population, and one of the way of relaying your findings to people is when you're able to communicate to them well,
Yeah.
and when there's no language barrier.
Yes.
So she's doing it so well that people in the, that are in the lowest of the lowest can easily get the information she's passing. And then she explained it so well that you could understand why this thing is happening to me in my body and things I can do to prevent this. And if I'm seeing this symptom, this is what I'm supposed to do. She made it so interesting, and it's really nice. I just like her content every time.
Thank you for that response. That's so amazing. So it's time to go into games.
Okay.
Are you very ready for this one?
I think so.
Don't worry, you stand the chance to go with 1 million naira. I will be that
Pleasure.
to you. Okay, so I'll be okay. What you actually have to do, we are matching the disease to the body parts they actually affect. So I'll
Okay.
list the disease and you tell me the body parts they affect.
Okay.
So the first one is rickets.
Because I think that's bones.
Yeah.
Bones, right?
Yes.
Yeah. Sure.
Your money is still intact. Then Addison disease.
Addison disease should be pancreas.
Yeah, you got that right. Yes. So the next one is nephritis.
Kidney.
You just said it like, oh, that was so
nephro,
easy.
yes.
So we have the glaucoma.
Glaucoma high.
Yeah,
Yes,
thank
right.
you so much. So we have the Bowles line.
Think your nails.
Oh, you're so intelligent.
Thank you.
So we have the cobblestones, which is the last one.
First stones should be.
Now decide if your money will reduce or not.
Do I get options?
Okay, should I give you options?
Yes.
Okay, A is legs, B is throats, then C is should I call it now? So I don't have any idea of what it is. D. You didn't want me to finish. Yeah, you got that right.
Thank you.
Yes. So I think we've come to the end of the show, and thank you so much for coming and thank you so much for sharing so much insight. And I hope that our viewers have been able to like learn one or two from you today, and then you've been able to expand our knowledge. Thank you so much. Really appreciate.
Thank you.
And
too.
to our viewers at home, thank you so much for always liking and subscribing. Let's keep the numbers climbing. We love you all so much, and see you next time.
Thank you so much. Bye.